Hello everyone, welcome to HIM 225. This is a continuation of the lectures covering Chapter 22 in your textbook. This is your fourth lecture, and we're on page 538 in your textbook. And we're looking at the instructional notes for when a delivery occurs. And basically, this guideline tells you that when an OB patient is admitted and they deliver during that admission, the condition that prompted the admission should be sequenced as the principal diagnosis. If it's a perfectly normal vaginal delivery, meets the definition of normal vaginal delivery, then we can use that code 080. If not, we choose the appropriate pregnancy complicated by code. It also tells us that if multiple conditions prompted the admission, then we're going to sequence the one most related to the delivery as the principal diagnosis code. And we'll look at an example of one of those in a minute. A code for any complication of the delivery should be assigned as an additional diagnosis. If the patient has a cesarean delivery, and if the patient was admitted with a condition that resulted in the performance of that C-section, then that condition should be sequenced as the principal diagnosis. But if the reason for the admission was unrelated to the condition resulting in the C-section, then the condition related to the reason for the admission would be sequenced as the principal diagnosis. Okay, so basically what this says is that if it's not a routine delivery, the condition that occasioned the admission should be sequenced first. If they have a C-section, that condition, the reason they're having the C-section is typically the reason for the admission. So let's look at this second example. A patient's admitted to the hospital in labor at 40 weeks. So we know that, number one, she's term, and this is her third trimester. She's 40 years old. She is elderly, but we would not use a code for pregnancy complicated by elderly, because those codes, it tells us in the guidelines for supervision of high-risk pregnancy, that those codes from that category of 009 are only assigned during the prenatal period. So even though she's 40, we're not using an elderly multigravida code. Her labor presents uneventfully. This is her 6th pregnancy, and the baby weighs 11 pounds. The physician who delivered this baby documents LGA, large for a gestational age. So even though she had a vaginal delivery, because he documented LGA, we are no longer at an 080 code. We now have to code the fact that she has had a baby that's large for gestational age. So we're also going to be coding the fact that she is 40 weeks. This is a live-born infant, so our outcome of delivery is Z37.0. She had an episiotomy that was repaired, and this is considered to be a manually assisted delivery. So let's start using the index, and let's look for some codes. Now I'm going to tell you that if I go to pregnancy complicated by large, we won't find anything. But so no large for gestational dates. So you need to make a note of this. You need to go over to page 547, where it has the additional terms that you can look up for finding codes, and you need to write large for dates because in the index we put in large, and the initial code, we find large and then large baby. This is a code P08.1. This would go on the baby's chart. It would absolutely not go on the mother's chart. And of course, this is based on the weight of the baby. Baby weights are in grams, not pounds and ounces. We have to convert them. But large for dates, and you see that this unessential modifier is infant, again, P08.1. We know that is absolutely not the code we need. Affecting management of pregnancy, and this code begins with an O. So we know that this is the code that we need to go on the mother's chart. O36.6. And when we get over to this category, let's scroll to the top real quick, long category, and we can see that this code requires a 7th character which specifies the fetus. We have a single baby, so we're going to assign that 7th character of 0. So let's go back down to this particular code. And these codes are they're assigned based on the trimester. So O36.63X0. And this is for our 3rd semester, large for gestational age pregnancy. Now, I want us to look at outcome of delivery. We are going to, let's go to this particular category. And if we have a single live birth, that outcome of delivery is Z37.0. And you can see that in this category we have codes single live birth, single stillborn, but again, as I mentioned in an earlier lecture, stillborn babies do not get their own chart, so it is very unlikely that you would ever assign this code. It would not go, I'm sorry, that's incorrect. If the mother has a stillborn baby, she does get this code Z37.1 on the chart to reflect her outcome of delivery. I'm thinking about the code on the baby chart. I apologize. If the mother has twins and they're both live-born, we're at V37.2, 1 live-born, 1 stillborn, twins, both stillborn, and then other multiple births. So regardless of the number of infants that this mother delivers, she is going to have an outcome of delivery code. And for single live birth, Z37.0. And so as we, then the next thing we want to look at is this, we need to go to the procedure tab. And this patient had an episiotomy. Now, I want you to notice that this code for episiotomy is coming from medical surgical. It is not coming from obstetrics because this procedure was performed on the mother. Remember that when we're coding from obstetrics, those procedures are for the product of conception, which the baby is the product of conception. So when you look up the code for episiotomy, here it is, full code. You'll use it often. You may just want to write it down. It's not going to change. Nothing will impact it. And then if we go to, well, I tried to look up manually assisted delivery, but we won't find it there. Delivery. Manually assisted. 10E0XZZ. And again, that is not going to change. So if you want to write that down, so anytime you have a manually assisted delivery, you can assign that. And those are the codes that we use for this example. Let's look at the next example. The patient's admitted to the hospital for severe preeclampsia. She's 36 weeks, so she is term. There's no evidence of labor, and they perform a low transverse cervical cesarean section, and it's performed immediately, and she delivers a healthy baby boy. So we have pregnancy, so in the index, I can put in pregnancy complicated by preeclampsia, and this is severe preeclampsia. So we would select 014.1, and she is in her 3rd trimester. Now, she delivered, so it's not just 3rd trimester, it complicated childbirth. So it's 014.14 is our principal diagnosis code. If she had not delivered, then we would use 13, but she did deliver, so we are using 14. Now, she was 36 weeks gestation, so we would assign that the code Z3A.36 for her weeks gestation. So we see 36. There it is. And she did have a live birth. So Z37.0 for our outcome of delivery. And then she had a low transverse C-section. So in procedures, we can type in cesarean section. And you can see that the section it comes from is obstetrics, not surgery, because this is being performed on the products of conception. Body system is pregnancy. The root operation for this is extraction. Our procedure is open. And this was a low transverse. So 10D00Z1 is the procedure code. The next guideline is outcome of delivery, and this tells you that a code from category Z37 is assigned to every maternal record where a delivery has occurred. We looked at that category. These codes are not used on subsequent records or on the newborn record. So a mother has a baby, she's discharged, she's readmitted. She does not have another Z37 outcome of delivery code. This code is only assigned to the maternal chart for the admission where that mother delivers. So let's look at this example. Healthy 40-year-old prima gravida presents to the hospital at 37 weeks and delivers twins vaginally. This looks like a perfectly normal delivery, but it is not a single infant, so we cannot use our code of 080 because this is twins. Now, in the index for delivery of twins, you would think that you could go to delivery and then twin, but you cannot. You must go to pregnancy. And you know, my internet is not as fast as I can type. So pregnancy twin 030.00. And when we come and we look at this category, we have a number of, we're in the multiple gestation category. You see I have an instructional note, code also any complications. But these codes have information to include the number of placenta and the number of amniotic sacs. When you're looking at these deliveries and these pathology reports, they're going to tell you how many placentas and how many amniotic sacs there are. So you'll be able to appropriately choose those codes. For us, it's not specified. But if you go down and look, you'll see the information about twin pregnancies. Now, our woman is 37 weeks, so she is term. She is in her third trimester. 030.003. We're upon the week's gestation, Z3A.37, and then her outcome of delivery is twins. So if we go to twins, they are both live born, so Z37.2. Now, it does not say here that she had an episiotomy. The only thing that we will code for a procedure here is the manually assisted delivery, so the 10E0XZZ code. In the next example, we have a pregnant woman. She's 39 weeks. She comes to the hospital for delivery of known quadruplets. So she's taken to the operating room for a low transverse C-section. All the babies are delivered. It is discovered that one has died in utero. So for this particular example, we are going to have two delivery codes, one for the quadruplets and another one that reflects that there was a fetal death. So in the index, we're going to pregnancy and then quadruplet. We have an unspecified number of placenta and unspecified number of amniotic sacs. So we are at category 030.20, and we have a quadruplet pregnancy, unspecified number of placenta, unspecified number of sacs. So we're choosing that sixth character of 3. Now for the infant that was stillborn, that is a fetal death. And we go to pregnancy complicated by fetal death. 036.4. Let's look at that code in the tabular. And we're going to need additional characters. We're going to need a 7th character that tells us which fetus it was, but we do not know which fetus. So we would choose the 0. Maternal care, well, actually, yes, we do not know which fetus, so we are choosing the 7th character of 0. We have to have our X placeholders, and that's intrauterine death, not applicable or unspecified. And for us, it's unspecified because certainly we know that there were 4 infants. Now, we're adding our week's gestation code, Z3A.39. And then for our outcome of delivery, we had some live born and we had quadruplets. So quadruplets, some live born, Z37.62. And then this was a C-section. So in procedures, we're going to cesarean. 10D0, and it was open. There was no device, and it was low for 1. Now, that will conclude this lecture for Chapter 4. For the question, please go to page 553, and you're going to be exercise 22.3. You're going to be answering question number 9. And as with the other questions, this is going to be a multiple choice question for you. This is a pregnant woman. She comes in with a diagnosis of severe preeclampsia. She has smoked her entire pregnancy. She is 35 weeks pregnant, so that is considered to be a preterm delivery. And she goes on to deliver a baby girl vaginally. So you'll select the appropriate codes and select the correct answer for that.